Hello, Dr. Kelsey. Me and Clint right here are going to be doing the ear exam today. So I'm going to introduce myself. Hello, Clint.
Hello.
My name is Matt. I'm going to be your chiropractic intern. We're going to be doing an exam of your ear, and just let me know if anything that I do makes you uncomfortable, and we can modify as needed. So first we're going to start with an external inspection of the ears. So we use our light here. We're looking for size, shape, symmetry, as well as any exudates coming out of the ear, or any lesions or deformities. So we'll do that bilaterally. And go all the way around. And so after the inspection, we're going to do a general palpation. So we're just going to palpate the pinna, the lobe. We're going to palpate around the front of the ear to the back. Then we're going to pull on the pinna, and we're going to push on the tragus. And both of these things are elicit pain, and that might indicate otitis media if you push on the tragus and there's pain, or otitis externa when you pull on the pinna. So we do that bilaterally. So we'll palpate, and we're going to pull on the pinna, push on the tragus. Okay. So the next part of the exam, we're actually going to be looking in the ear. So I'm going to tilt the patient's head back. I'm going to use my right hand, right eye, going in the right ear of the patient, and pinky on the patient's cheek to prevent any slipping. So we're going to actually pull on the pinna to open up the canal. We're going to insert. You okay? Okay. So we're going to be noting a few things in the ear. We're going to be looking at the tympanic membrane and all the components of the tympanic membrane, which are the handle of the malleus, the incus, the umbo, where the malleus attaches to the tympanic membrane, the pars tensa and the pars flaccida, and we're going to know all of those structures. We're also going to look for signs of otitis media. There are three types: acute serous otitis media, and that's going to have an amber color on the back side of the tympanic membrane, and it's going to cause a retraction of the tympanic membrane, which will be indicated by the cone of light becoming thinner. We're going to look for acute suppurative otitis media, which is going to have a bulging tympanic membrane and a beef red color, and that's the bulge is going to be indicated by the light scattering instead of having a good cone of light. And then we're also going to look for chronic suppurative otitis media, and it can only be chronic if the eardrum has been, or the tympanic membrane has been perforated. So we're going to be looking for any holes in the tympanic membrane. And I'm actually going to look in his other ear as well. So left hand, left eye, pull the pinna back. Okay. And that completes the eye exam. Thanks for watching.